Skin and soft tissue infections, or SSTIs, are one of the most frequent indications for antibiotic use in the ambulatory care setting. However, in many cases of cutaneous abscesses, antibiotics may not be required once adequate source control has been obtained. Current guidelines recommend the addition of antibiotics in only certain circumstances. Despite this, evidence indicates that giving antibiotics as an adjunct to incision and drainage, or I&D, is common practice. One retrospective study of SSTIs managed in the emergency department or clinic found that about 75% of simple cutaneous abscesses were treated with both I&D and antibiotics. Moreover, half of the patients received 10 or more days of antibiotics, a prolonged duration. This case allows us to review the current recommendations for treating cutaneous abscesses. First, optimal management of many cutaneous abscesses requires incision and drainage, particularly those that are in accessible locations. This patient's abscess was about 2 centimeters in diameter and located on his arm. Prescribing antibiotics without I&D was not an appropriate choice. Second, in many cases, antibiotics may not be necessary if adequate source control has been obtained. Current evidence suggests that the clinical response rate for I&D alone is 70% or higher. Other studies have shown similar clinical response rates for I&D plus antibiotic therapy. As discussed earlier in this case, a large clinical trial has recently shown improved outcomes in patients who received trimethoprim sulfamethoxazole after I&D instead of placebo. However, many of the patients included in this study were sicker than our patient, who was young, healthy, had no history of fever, had normal vital signs, and a relatively small abscess with a small surrounding ring of erythema on exam. In the absence of more evidence, we recommend that clinicians reserve antibiotics for patients with risk factors outlined in the IDSA guidelines, as described earlier in this case. Third, in most cases, like this patient's, cultures from I&D are not necessary. However, if antibiotics are necessary, it is important to send cultures. Microbiologic data allows confirmation that your patient is on an appropriate antimicrobial therapy. Fourth, if antibiotics are required, empiric coverage of community-acquired methicillin-resistant Staphylococcus aureus, or MRSA, is necessary. Appropriate choices are highlighted earlier in this case. Given that the vast majority of cutaneous abscesses are due to Staphylococcus aureus, empiric gram-negative coverage is not necessary in most cases.
Come in.
Hi, it's nice to see you, Jim. How's your wrestling season going?
Actually pretty good this year. Thanks for asking.
I'm glad to hear it. What can I help you with today?
Well, 3 days ago, I noticed a bump on my arm, and it totally hurts and just feels really warm.
Oh, I'm sorry to hear that. May I examine it?
Sure. Just try not to press too hard because it's really sensitive.
Has this happened before? I don't recall you coming to see me for something like this.
No, I've never had anything like this before, but 2 of my teammates have had big pimples like this in the past few weeks. They told me their doctors gave them antibiotics for it. I just hope you don't think we need to pop it open.
Have you noticed any other symptoms?
Not really, except that my whole arm just really hurts.
Have you had any fevers or chills?
No, not that I've noticed.
Do you feel like this redness is getting bigger?
No, I haven't seen that.
Well, let me examine you, and then we can discuss the next steps.
Okay, sure, sounds good.